Hi everyone, this is Dr. Diane Hayden with Natural Nutmeg Magazine, and welcome to our Lunch and Learn live videos with our experts from the magazine, speaking about how to deal with the COVID-19 situation and just general uplifting topics on holistic lifestyle, how to be more healthy, and how to integrate these things into your daily life. So today, I'm excited to have with me Dr. Veena Verma. She is a board-certified naturopathic physician and certified medical acupuncturist who is highly experienced in treating both acute and chronic health conditions. Dr. Verma received her doctorate from the University of Bridgeport College of Naturopathic Medicine and received further training and certification in acupuncture and Lyme disease. Her other specialties include women's health, ADD, ADHD, GI conditions, mood imbalances, allergies, and fatigue. Each patient she sees receives personalized, individualized care involving research-based treatments and therapies from her own clinical experience and success. The therapies she prescribes include herbal medicine, nutritional therapeutics, homeopathic medicine, low-dose immunotherapy, and acupuncture. And she works collaboratively with practitioners and therapists in her office at Insight Counseling in Ridgefield. So thank you so much for being with us today, Dr. Verma. How are you?
Thank you. I'm so grateful. Thank you so much for having me here today.
Awesome, awesome. So we have a lot of stuff to talk about. Probably most timely is just everything that you've been seeing in your practice and the patients you've been working with during the whole COVID-19 pandemic. So I guess let's just start with that. I like to ask practitioners now, what advice are they doing and what kinds of tips and things do they really want people to know about in terms of dealing with the COVID-19 situation, regardless if it's someone who's actually been diagnosed with it or someone who hasn't. What kinds of advice are you giving to people?
Well, I mean, since we're still in the midst of trying to find a treatment, I'm very optimistic that they will find a treatment very soon. In the meantime, we can rely on supplements in our nutrition to help support our immune system, which is known actually by a lot of studies. Even the Harvard School of Public Health will advise that it is wise to rely on good quality nutritional supplements to help support the immune system that are known to help reduce the risk of infection. So there are so many supplements out there that are, even if you go and just research on PubMed, there are a lot of studies to help support their benefits. Some of them, I'll just name a few of the ones that I'm commonly prescribing. Vitamin C, obviously, it's being used in a lot of clinical trials, especially IV vitamin C along with COVID, and it's showing that it helps decrease the duration of time in ICU and also the need for mechanical ventilation. And this also is another treatment that's used in supportive care for cancer patients. And the reason being is because it helps with the whole natural killer cell activity, your overall immune function, decreasing inflammation. So that's one go-to, and this is very commonly known. The other vitamin, of course, is vitamin D. This one is, most people are deficient in vitamin D. In fact, there's another study that's done with all the countries that are being affected with COVID. Those with the highest rates of mortality actually are those also who have the lowest levels of vitamin D. So in vitamin D, as again, for immune system health, and one of the things that probably is not commonly known about vitamin D is that it actually helps support those tight junctions that line the lining of our GI tract and our lungs, which is also very, very crucial with our supporting our immune system. And as you know, within the GI tract, we have that most of our immune system lives in the GI tract. So vitamin D is extremely important. Another common supplement that I even prescribe for my Lyme and Candida patients is monolaurin. Now, monolaurin comes from coconut oil, and the way that it works, it actually helps disintegrate that viral membrane and helps preventing it from attached to the host cell too, and it helps prevent it from maturing during that late stage viral replication phase. So monolaurin is also a really great antiviral, and it's shown effective against HIV, EBV, CMV. They're even doing studies now on its anti-HIV properties. So it's a really, really great supplement. Again, a lot of studies to support the use of some of these. Another one I use a lot, and one of my favorites is actually NAC. So it stands for N-acetylcysteine. It's an amino acid. It has so many functions. It helps support your immune function by working on the NF-kappa B, which is involved in that whole cytokine cascade that is a problem with a lot of illnesses and inflammation, even COVID. And the other thing it does, it actually crosses the blood-brain barrier. So I'll give this a lot also to my Lyme patients because it helps support the cognitive function. And also it could potentially, knowing that it does cross the blood-brain barrier, it could, who knows, potentially help with dementia too down the road. So it's one of those great supplements. And along with that, it actually helps with our glutathione, which is another issue with a lot of people who have, Lyme and also COVID and any chronic illnesses. Glutathione tends to be low in people with chronic illnesses. So NAC is a precursor to that. And a lot of times when you're low in glutathione, taking that isn't just enough. So taking NAC along with alpha lipoic acid will help replenish those supplies, which is also something that is seen with my MTHFR patients. So that's another way of supporting them as well.
Yeah, that's great. I'm so glad that you brought up vitamin D, because I just saw, and I'm sure other people have seen too, a couple of articles that have recently come out warning people not to take vitamin D for for prevention, or even, if someone who has been diagnosed positive for COVID-19. And it makes me so angry, because I'm like, okay, first of all, they're talking about, how dangerous it is because, to take high dose vitamin D. And yet these studies aren't that they're sourcing, like, don't even explain, first of all, the rationale for why you take vitamin D, and then what the dosage should be. They just make this blanket statement of, it's not safe to take vitamin D. So I don't know how you feel about that.
No,
yeah.
Yeah, I'm all about vitamin D. I mean, the studies support it. It's there. People who, have even been diagnosed with cancer, a lot of the times these patients have had low vitamin D, and not even within normal range, not even on the low end of normal. So I'm all about vitamin D. Like I said, if the studies are there, so you should take vitamin D. Absolutely.
Yeah, I agree, definitely. So that's great. We talked about, the typical supplements that you recommend for people. Let's talk a little bit about other issues that people are dealing with throughout this whole situation. I mean, I know people are dealing with stress and anxiety, depression, sleep issues. I mean, whether, even if you don't have a situation where you've been laid off from your job, or your business, has been shut down, I still think that there are many people who are still under a lot of stress while they continue to work, whether it's their working condition, or just, living through this whole thing, and, dealing with friends and family who may have situations where their businesses have been closed or they've been laid off. So what kinds of things are you recommending for people to deal with, all of the stress and anxiety of this?
Yeah, I mean, the stress is a big problem, especially with everything else that's going on in the world. The anxiety is really heightened. And so when it comes to that, I mean, there's so many things. Fortunately, we've all band together to help each other out. That's huge. So there are a lot of practitioners out there, including my colleagues at Insight, that are running, Zoom webinars that can help with stress. One of my colleagues does DBT, which is phenomenal. It's supposed to help teach coping mechanisms during stress and anxiety. Also, there are a lot of yoga instructors out there doing Zoom classes, meditation. I tell my patients they're great apps too for meditation. And there are so many different styles of meditation. There are ones to help with sleep. There are gratitude meditations, which I personally love the gratitude one. I listen to them before I go to bed at night and even when I wake up, because it's just a nice reminder of all the things that we should be grateful for in life. And some of those apps, Beautify is great, Calm, Headspace. I even go on my Peloton app and I listen to that several times during the day. Getting exercise too, that helps with balance out our stress levels. The endorphins really are beneficial in helping calm us down. So I highly recommend that, getting out, trying to stay connected with people. Another issue, that comes into play is the sleep. This is one of the most common concerns I hear about, from friends, from patients. Everybody's sleep habits are completely thrown off, including a lot of teens too. So it's really important to reset that sleep pattern. And the reason being is sleep, believe it or not, is so crucial to our health. It plays a big role in balancing out all of our hormones, our stress hormones, and also plays a role in our nervous system activity, our sympathetic nervous system activity. And long term and short term, there are a lot of, consequences of having poor sleep. It can contribute to chronic inflammation, mood disorders, cardiovascular disease, metabolic syndrome, and also more inflammation, and just making us feel even more ill than we are, and actually ends up bringing our immune systems even down more. So sleep is really important. So in ways to get reins on our sleep again is slowly start resetting our clocks back. So we're instead of going to bed so late, slowly start moving our bedtime sooner. So this way we can reestablish our clock again. That's one way in doing it. Melatonin is also, for those people who are really deficient in melatonin, just can't get that sleep pattern back. Melatonin is also very helpful in getting our sleep back in order. Also working on our cortisol levels, our serotonin levels. Those are other ways in which we can help get our sleep back. But really, ultimately, it's going to be behavioral. So we really want to focus on resetting our clocks.
Yeah, I'm glad we're talking about that because I think a lot of people don't realize how important sleep is, and that's really the only time when our mind is shut off. When our conscious thinking mind that's going, that's causing most of these stress and anxiety is turned off, our subconscious takes over, and our body is able to, repair and basically slow down all of those chemicals that you were talking about that are going through the body all day long because we've been, watching the news and looking at social media. And I love what you said about just, going to bed a little bit earlier. All that stuff will be there for you tomorrow.
Turn off the screens. Don't go on the screens. That's another thing. Just turn it off. Keep it out of your bedroom. Don't even look at it. Another thing I do want to bring up about this whole quarantine with everything that's going on that I don't know if a lot of people are aware of, those people and kids who have social anxiety, these are our kids that are kind of living it up at home right now because they're in quarantine. And things will open, thankfully we're getting to that point soon, and they're going to have to go back out there, and that whole social anxiety is going to set in again. This is also another key time to help those kids and adults who have social anxiety, to teach them the tools to help them get back out there so they can be more at peace and more successful. So that's something that, I actually am personally seeing at my own house too. We're a little too happy at home right now. So we need to definitely prepare ourselves.
Yeah.
And getting back there. Yes.
It's so interesting just to see people that go through this whole thing where some people, you're saying, are very happy being at home. They're like, this is awesome, they're the homebodies. And then there's other people that are bouncing off the walls like, oh my god, I gotta get out of here, I can't go to my favorite restaurant, I can't get my hair cut, I can't do this and that. So it's just very interesting. So either way, there's stress on both sides, whether you actually like being in your home space. You're right, eventually when more and more things open up, we have to go back outside again. So it's probably true that many people aren't thinking about it like that. So it's great that you brought that up and you support that. So let's talk a little bit about your more of your expertise in terms of what you do with your practice. So one of the things that you treat is Lyme disease, which is not an easy thing to do, for sure. It's very tricky. So I appreciate that, you have done a lot of work with that. So what do you think some of the biggest struggles your patients experience with Lyme disease? What do you think that they are?
A lot of the issues my Lyme patients have, it's, you know, getting past the fatigue, the brain fog. A lot of times I'll have my patients on different herbs and they're still not yet able to move through those symptoms that affect their daily life. And with those patients in particular, it's almost like I have to hit reset with them and focus on their drainage, making sure that their liver is functioning optimally, their lymphatics. So that's something I definitely tend to have to hit restart with some of my patients in order for them to go up in doses. It's really not cut and dry at all. I know there are a lot of protocols out there. It's not a one size fits all treatment plan for anybody. Everybody's so different. I with all my Lyme patients, I don't treat any two the same. They're all completely different and they all have different needs. You know, I have some patients with chronic pain, then I have those that have underlying GI issues from being infected with Lyme for so long. Again, I mentioned the brain fog. A lot of my patients have cognitive impairment too. Are these things treatable? Yes, it just takes time and it takes patience. These patients, they don't get better within a month or two, but it could take a year. So that's definitely something that people need to be aware of. It takes time. And not only do I treat with herbs, but I do work collaboratively with other physicians. I work with two allopathic doctors and, you know, and also nurse practitioners. So when I do feel that a patient needs antibiotics, we'll discuss it. Of course, it's always within the patient's best interest, whatever they want to do, that I support them. So I have patients that come see me personally just for herbs. And then I have some patients that will go to one of my colleagues and see me at the same time. But regardless, we all work together, both myself and my patients, in helping them get better.
Yeah, I mean, I think you really do need a multidisciplinary approach because there's just so many facets to it. I mean, I know so many people who've had Lyme disease and, you know, people that seem to have somewhat of a more mild case, and then other people who it seems like they're struggling with it for years and years to finally get better. And I think it's just because it's such a unique disease in the sense that it can morph into other things and then cause other issues in the body and that kind of thing. So it's, you know, it can be very complicated.
It can be very complicated. And once it starts causing other issues, there's a lot more. Now I'm not just treating Lyme, then I'm treating, you know, a mold toxicity, candida, depression. There's so many other elements that will come along with this disease. And, you know, also, again, like having family members with it, I don't waste my time when it comes to treating a tick bite. I don't, not at all. I don't advise it based on how severely ill somebody can get. It's not something I recommend. I recommend treatment immediately.
Right. Yep. Definitely. I think that's the best course of action too. I have a good friend whose son actually, before he was diagnosed with Lyme, he had all these issues, every symptom that you just named, I think, and that they first figured out that he had a mold, he was sensitive to mold in his apartment up at Yukon. And then it sort of morphed into figuring out that he had Lyme disease. So it almost went the opposite way, but it's like, yeah. And then because they had waited so long to test for Lyme and to figure that out, it was at least 2 years of treatment and all kinds of things. And he went through exactly what you're saying, the depression, anxiety, all kinds of other physiological things. So yeah, the earlier the better.
Yeah, a lot of these times, like these patients with Lyme, they'll be misdiagnosed. I've had patients that have come in and with anxiety, depression, even the whole issue with socializing in school, some of these kids, because I treat children also. And just it would happen all of a sudden. And my intuition is always to check other things first and not just think a kid is being a kid and it's just part of their development, because a lot of times it's not. And I'll end up diagnosing them with Lyme, and that was why they were so depressed the whole time.
Yeah, definitely. So I noticed also you mentioned you specialize in treating MTHFR. So let's talk a little bit about what that is. I'm sure there's many people listening to this that are like, what do all those letters mean? So yeah, like let's start by explaining what that is and then how you treat it.
So MTHFR stands for methylene tetrahydrofolate reductase. It's a long word. So it's an enzyme that actually, the way it works is it helps convert our folic acid and B12 into its methylated form. So it can be used by the body in different pathways. So if you just go online and Google methylation cycle or methylation pathway, there's this whole thing that goes on within the body that requires these vitamins. One, it's essential for our liver detoxification pathways. It also is essential in our immune function. The other big thing is it plays a huge role in our neurotransmitters, which are those chemicals that are responsible for our mood. And then also what goes along with that too are, homocysteine levels, glutathione levels. So MTHFR gene mutation is actually associated with a lot of conditions, Parkinson's, dementia. It increases the risk of certain types of cancer, different types of mood disorders, infertility, frequent miscarriages, so migraines too. It's linked with a lot of these health conditions. And when typically when I get a patient who hasn't been diagnosed with it yet or doesn't have that yet, the light bulb goes off when I hear that they have an autoimmune condition. Usually it's a thyroid condition, and a family history of that, their depression or anxiety. Some of my patients have had miscarriages in the past too. So these are kind of things that go off in my head when I think about MTHFR. Treating it also it's not always that simple either. Giving just methylated B12 and folate in a supplement isn't always the answer, depending on how severe a patient is. I mean, a lot of people tend to have this gene mutation, but some people walk around, they're totally fine, they don't have any symptoms of it, but others, they have more of a genetic defect going on, and they'll have more symptoms that they are exhibiting. And in those patients, those especially, that's where we really need to get in and treat them. So again, not with just supplementing with those vitamins, but then if they're suffering, some mood issues, I'll go in and look at their neurotransmitters and figure out what's going on there. If they're having insomnia, I'll go treat that. So knowing which neurotransmitters are involved with the different symptoms that they're experiencing, I'll go and treat that as well. Because a lot of times you have to go in and replenish. And this also happens actually too with a lot of my chronic Lyme patients too, where they're just not detoxifying enough. And with MTHFR, a lot of times, again, that's associated with a lack of glutathione, that our body's natural antioxidant. So I also have to go in there and support their liver pathways to help get them better.
Yeah, that's interesting. I mean, I have that gene mutation, but I don't really have, so far to date, any symptoms. I'm one of those people that's walking around and not, feeling fine or whatever, but I still take, like a B complex. I still take glutathione because I know that, okay, great, I don't have any symptoms today, but that doesn't mean as I, get older that certain things aren't going to function as well. And maybe now that gene expression gets turned on more, who knows, So I think it's, a good thing if you know that you have that, to at least do some of the, moderate supplementation, like, like what I do, or you might suggest something else, but at least to do that, even though you don't really present with any symptoms right now.
Right. Yeah, I think it's a great idea to do that. I mean, even just like look at anti-aging medicine, this is also helpful in doing that. So, because knowing that it can be a predisposition to dementia and Alzheimer's, there is absolutely no risk in doing these things and supporting your body the best that you can. Absolutely not. So I think it's great that you're supplementing. I also supplement myself along with NAC. I take ferrochrome turmeric. I take that every day on a regular basis. And I think it's really important to, as far as, just our overall aging, to take these things.
Yeah, I totally agree. I totally agree. So let's talk about allergy season. It's so funny that we're talking about that. It's not funny, but I think it's interesting that I feel like if I don't have bad allergies, but I feel like every once in a while, like I'll feel like I need to sneeze or I'll have a cough or something, and now I'm freaking out because I don't want to cough in front of anybody because everyone's like, "Oh my God, does she have COVID?" and it's like, hello, it's also allergy season. People are going to be sneezing and coughing, and they might have a runny nose, and you're going to see these things because this is that time of year. So I'm glad that we're talking about this. I think it's really timely too. So tell us a little bit about how you help your patients with relation to that.
Well, being on an anti-inflammatory diet does help. I will, full disclosure, I have had my share of allergies. As a kid, I had eczema. I remember being bandaged because I would just scratch, 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 scratch. So I do have a lot of personal experience with allergies. And, you know, fortunately for my patients, I like to test things out on myself before I dish it out. So one of the things I do is LDI, low dose immunotherapy. This is a therapy, it's almost like homeopathy, and it's very similar to the allergy shots, but they're actually drops that you do under the tongue. And the way it works, it helps build immune tolerance. So of course, when I first learned about it, I had to test it on myself to make sure it worked. And one of my biggest allergies is mold. So I test, and where I live on wetlands, and it got to the point where I would stop sneezing as soon as I left my neighborhood. And obviously I'm not in a position to just get up and move anywhere. So I had to do something about it. So I tested out the LDI and my symptoms went away. It took time. Again, it's not a quick fix. It took me a few months to get back to where I was so I can live in my house and enjoy my house, but it does work, definitely.
Yeah.
So that's one way I treat my allergy patients. And then of course there are other supplements like quercetin and everything else, but I really found the LDI to be most helpful for me personally.
Yeah. I think like I've taken NAC in the past too, what you were talking about earlier. I've taken that if I feel like I have any kind of like, you know, allergy thing going on. I think that has been effective for me.
Yeah, a NAC is wonderful. And you know, if you take that away from food, it actually helps break down those mucus proteins better so you can get rid of the mucus more efficiently.
That's awesome. Yeah, that is great. Well, this has been awesome. I appreciate all the information that you've given us, and I'm sure that people will be looking to reach out to you. So how do you want people to learn more about you and connect with you?
Well, I'm on at Insight Counseling in Bridgefield, so you could find me on that website. I also have my own website, which I'm still working on. It's Fairfield Naturopathic Health, so they can go to either one of those websites to find more info about me.
Okay, that's awesome. So it's is it insightcounseling.com? Okay.
Yeah, insightcounselingllc.com, and the numbers on that website there too.
Okay, perfect. InsightCounselingLLC.com. And of course, you can find us at naturalnutmeg.com, and our social media site is at Natural Nutmeg Magazine. And this recording will be e-blasted out and also on both of those sites. So again, thank you so much for being with us, Dr. Verma. We really appreciate it and hope you have a great rest of your day.
You too. Thank you so, so much. I really appreciate it.
All right, everybody have a great day.